There's no doubt that this third wave has been different from anything we've faced so far. The risks are greater and the stakes are higher. And right now, we have a two-part strategy. First, get needles into arms and limit mobility, limit the spread to protect our ICUs and hospitals. We need to get the vaccines where they will have the greatest impact as quickly as possible. Yesterday, we announced new details on how we're going to get more vaccines to hotspots right across the regions as quickly as possible. This will be critical to getting this third wave under control. We're moving into the next phase of our vaccine distribution strategy. As we speak, mobile vaccination teams are being organized to get vaccines to where they will have the greatest impact. We're deploying numerous mobile vaccine clinics in shelters, residential buildings, community centers, as well as churches, mosques, synagogues, temples, and other faith-based locations in the highest risk neighborhoods. This will include mobile vaccine clinics in high-risk workplaces that will remain open for the sake of our supply chain, starting with those in hotspot regions. As we bring these mobile clinics online, vaccines will be eligible for people aged 18 years of age and over in the high-risk neighborhoods. Friends, our frontline education workers are absolute champions. And while our experts tell us that schools remain a safe space for students and workers, we want to do everything we can to keep them the same way. So beginning next week, workers who support students with special education needs across Ontario, as well as all education workers in high-risk neighborhoods in Toronto and Peel, will be eligible for vaccines. And as the supply, followed by a rollout to all education workers across the province. And as we ramp up our vaccine distribution, we also need to make sure we take the steps necessary to slow the spread of the virus and protect our ICU and hospital capacity. The reality is, despite everything we've done so far, the COVID-19 situation in Ontario is getting worse as these new variants continue to spread. Our hospitals are reaching capacity, and patients in the GTA must now be sent to other parts of the province for care. In fact, we learned yesterday morning that admissions to ICUs in the past week are increasing faster than the worst-case scenario predicted by our experts. My friends, I'm hearing from more and more of our hospital CEOs about the situation in our hospitals and ICUs. I can't stress this enough. Things are extremely, extremely serious right now, and I'm extremely concerned. The situation is evolving rapidly, hour by hour. And as things change, as we learn more about these deadly new variants, as we see new problems arise, we need to adapt. We need to move quickly and decisively. And right now, above all else, our plan is to get needles into arms and protect our hospitals. That's why today, on the advice of the Chief Medical Officer of Health, I'm declaring a state of emergency with a province-wide stay-at-home order effective 12:01 a.m. Thursday. This will be in effect for 4 weeks. With a few exceptions, the stay-at-home order will be similar to what we went through earlier this year. To boil it down as simple as possible, folks, please, unless it's for an essential reason, please stay home. Because the situation is extremely serious and we just need to hunker down right now. We need to limit mobility. Non-essential retail stores will go back to curbside pickup with delivery allowed from 6 a.m. to 9 p.m. Big box and discount stores will be allowed to sell essential items only. I'm going to repeat that, essential items only, such as food, medicine, cleaning supplies, and personal care items. During a stay-at-home order, residential evictions will once again be suspended because no one should live in fear of losing their home. And these measures are in addition to the emergency brake shutdown we imposed last week. I know this is tough on businesses, but I promise we will continue to have your backs. In our 2021 budget, we doubled the Ontario Small Business Support Grant, providing eligible small businesses up to $40,000 to get through this. But with these additional measures, we will limit mobility, limit the spread, keep people safe, and allow more time to deliver vaccines. And be assured, vaccines remain our best hope to beat this virus. Yesterday, we administered a record number of vaccines, over 104,000, for a total of 2.7 million to date. We also booked more than 100,000 appointments yesterday, and as of noon today, we have 128,000 appointments already booked for a total of 1.6 million appointments to date. And I continue to ask everyone to get a vaccine as soon as you're eligible to do so. Please, folks, this is how you can help us. All Ontarians 60 and older are now eligible to book their vaccination appointments by visiting ontario.ca/COVID vaccine or by calling 1-888-999-6488. That's 1-888-999-6488. And for all Ontarians 55 and over, we're rolling out vaccinations at more than 700 pharmacies across the province, with more added each week. You can visit ontario.ca/pharmacy COVID vaccine to find a neighborhood pharmacy that is administering vaccines. My friends, make no mistake, these next 4 weeks are absolutely critical. We have come so far already, and we just need to stick together a little longer because hope is on the horizon. I promise you that better days are ahead of us. Based on the vaccines we expect to receive from the federal government, so as long as they come through, I'm expecting that we will be able to have 40% of Ontario adults vaccinated by the end of the 4-week stay-at-home order. And that's when things start to change dramatically in our favor. But the decisions we make now, how we handle the next 4 weeks, what we do until we start achieving mass immunization will be the difference between life and death for thousands of people. And I can't put it any more clear than that.